If you ever took some biology, anatomy, or similar classes, you are probably used to seeing blood vessel models that look something like this. Due to their simplicity, these blood vessel models make it easier to explain a specific mechanism or a certain vascular structure. However, they fail to represent one important feature of the blood vessels, their hairiness. In reality, the lumen of the blood vessels is covered with a protective layer that resembles microscopic hair when viewed under the microscope. This hairy, or sometimes referred to as slimy layer, is called the endothelial glycocalyx. Hi, my name is Paula. I'm a Master of Science in Human Nutrition, and at this moment I'm particularly interested in the relationship between the endothelial glycocalyx and diet and lifestyle. As of today, the destruction of this peculiar structure has been related to atherosclerosis, hypertension, type 2 diabetes, chronic kidney disease, and some acute conditions such as, excuse my pronunciation, ischemia reperfusion syndrome and septic shock. I'm trying to find out if it's possible to preserve or regenerate this structure by implementing some diet and lifestyle interventions. Could this therapy be used to prevent cardiovascular disease? And if so, which intervention works best? I will try to describe various known and proposed functions of the endothelial glycocalyx and try to answer those questions. So, let's start with the introduction. On this figure you can see the position of the endothelial glycocalyx. It covers the luminal side of the endothelial cells. This means that it is in direct contact with the blood but also with the structures inside the endothelial cell. This important position is the reason for some crucial functions of the glycocalyx which will be discussed in detail in later videos. Endothelial glycocalyx is sometimes called the endothelial gatekeeper. Here you can see why. Nothing from the blood can enter the endothelial cells without first coming in contact with this structure. But it is not just a mechanical barrier. Most of its components have anionic ending molecules, which gives the whole structure a net negative charge. This net negative charge allows for it to interact with the blood proteins through ionic interactions, creating the so-called endothelial surface layer, or extended endothelial glycocalyx. It also creates repulsion against platelets and leukocytes, and in that way prevents blood clots from forming randomly. Here you can see a part of the blood vessel without the endothelial glycocalyx. The blood components are much closer to the endothelial cell surface and surface receptors. The removal of the glycocalyx is important in wound healing or acute infection, but may cause problems when the glycocalyx is chronically damaged. Another thing you may notice is that lipoproteins that carry cholesterol molecules have an easier path to the endothelium, where they can oxidize more easily and create atherosclerotic plaque. You may ask yourself now, if this structure is so important, how come virtually no one is talking about it? Well, there are a few answers, the most important being that reliable methods of detection are just being developed. When the blood flow is discontinued, as is the case with taking a tissue sample or studying individual endothelial cells, this dynamic equilibrium is no longer sustainable. The glycocalyx collapses, it loses the voluminosity, and most of its components are shed. We can measure the rate of shedding of individual components, and that measure is suited for acute conditions such as sepsis, where studies have found that people with high plasma levels of glycocalyx components suffer greater sepsis mortality. However, the endothelial glycocalyx undergoes continuous metabolic turnover dependent on the local environment, so these measurements might not be so useful in chronic conditions. And this is where the thickness of the glycocalyx comes into play. There are now emerging techniques which indirectly measure the glycocalyx thickness. One is called the Sidestream dark field imaging. The dark field imaging actually looks at the position of red blood cells and leukocytes, so the thickness is indirectly calculated from subtracting the total vessel diameter and blood vessel region occupied by the red blood cells. There are some other techniques, for example, fluorescently labeling the glycocalyx components, perfusion fixation methods, or liquid chromatography mass spectrometry. These techniques offer a more detailed look into the glycocalyx by, for example, looking at the differences between sulfatation patterns and comparing the patterns of, for example, diabetic patients to those of a healthy person. But these measurements are perhaps more suited for research purposes. In clinical practice, though, the Sidestream dark field imaging and similar techniques show the most promise. The measurements can be conducted on the patient's bedside and it is non-invasive. It is always good to lighten the burden of excessive blood measurements in patients. However, this detection method is indirect and relies on software analysis, so more testing, more validation is needed before we can introduce them into the everyday clinical practice. So there we have it, a quick introduction into this complex structure. If you find this interesting, I encourage you to help me get this channel up on its feet so we can spread this knowledge to as many people as we can, and perhaps we will inspire somebody and perhaps we can increase our vascular health. Thank you for staying until the end. In the next videos, I will focus on the details of the endothelial glycocalyx and try to see how this structure is related to vascular consequences of COVID-19.